forward to welcoming you to our hospital's international courses.
We are delighted to launch the first international educational program series at Imam Reza General Hospital, Tabriz, Iran.
Tabriz is a historical and vibrant city.
You will love our beloved city.
Join us for our educational programs.
We'd love to have you here.
Waiting for nice days together.
See you soon!
Hello everybody, I'm here with you with another dialogue, another conversation with one of the faculty members providing an educational international course in Tabriz University of Medical Sciences, Imam Reza Hospital. I'm pleased to host Dr. Sadra, Dr. Vahideh Sadra here today in this studio. Thank you for accepting our invitation and please start your talk.
First of all, I should thank you for managing this program and for inviting me. I'm so glad to be here and be with you.
Great. Dr. Sadra, we are waiting for your introduction, talking about your background, what you are doing, and then you will proceed to the course content.
Yeah, I have been studied internal medicine in Tabriz University of Medical Science, and I have been graduated in 91. Then I have been as a fellow of endocrinology, and because of I had 2 board rank in internal medicine examination of Iran, first ranking in internal medicine board examination and second board ranking in endocrinology board examination. I was accepted to be here as assistant professor in endocrinology ward, and I have been practicing near to 10 years in here in Imam Reza Hospital, of course endocrine ward, and now I want to talk about my program and my course, which is about thyroid nodules. We want to held this course for training the students for doing ultrasound guided fine needle aspiration of thyroid nodules. I think it is better to explain our practice in this center when we began to do this practice in Imam Reza Hospital. It goes to my fellowship. When I was endocrine fellow, I began to learn and to practice ultrasound guided FNA. I learned from radiology professors, and I asked them to help me because when you do FNA, fine needle aspiration of thyroid nodules with ultrasound guide, the results are very better, and you can trust them more, and it is better that in versus ultrasound guided FNA is blind FNA, which we do it. When you do blind FNA or fine needle aspiration, you cannot see the characteristic of thyroid nodules, and you cannot decide how to needle to make a biopsy and enter the needle. When you do this practice with ultrasound guide biopsy, you do it. First of all, you can learn thyroid ultrasound. If you should know about thyroid ultrasound, and you know about the nodules. These nodules are characterized to low suspicious, intermediate suspicious, high suspicious. First of all, you learn them that which nodule needs to be FNA'd. After that, you can decide that when this nodule can be it needed to be FNA'd, where to be needle aspiration, where of that nodule. And ultrasound gives you this opportunity, this, of course, chance that you do the best fine needle aspiration, and it is really trustable and very complete job. And that's why it has been about, again, I want to mention a history. I think I have been done biopsies, more than 1,000 biopsy, ultrasound guided biopsy here, and my colleges more than 200,000 or 300,000 biopsies. And our fellows here are learning, we are training them for doing this ultrasound guided biopsy.
Very good, very good. So there is a huge experience of doing this, and other colleagues other than you also do this. You are working in a fellow training center, and you have your fellows, so this should be a cutting edge knowledge provision for the international participants as well. I would like to ask you to talk about the other characteristics of the course. For example, how long you have decided this course to be, and whether it is flexible to be a little bit more or
yes, of course.
lower.
Anyhow, it depends on the participants too, but I think 1 or 3 months will be okay for training them. Some less or more will be good.
And who is eligible for the course? Do you intend it for internists or necessarily endocrinologists?
Not necessarily. I think those internal physicians who are interested in thyroid practice, they are working on thyroid especially, and focus on thyroid, they can come and learn, and they can practice they can practice and do it. And endocrine fellows are, they can come and learn about this procedure, and it is better to mention about this procedure too for my colleges. This is a non-invasive procedure. It doesn't need any anesthesiology. It doesn't have any pain, just little pain, and no hospitalization is needed, and no complication no complication is expected, of course. Rarely in those old patients who are taking antiplatelet drugs, we should be more cautious, and it may be a little bit hematomas and bleeding, but it is really rare, and I haven't seen more than 2 or 3 cases.
So the procedure is
non-invasive,
very less invasive, very minimal, painless, and also accurate, more trustable.
Yes, really.
If personally, I'm curious to know: is this a standard of care now, or still there are centers that do biopsies, FNAs, without ultrasound guide?
It's not a standard procedure because many centers, in many centers, ultrasound is not available for doing this procedure. But because of the accuracy, because of the pathology results that are accurate, we suggest for all centers to do this and to begin this procedure, ultrasound guided biopsy. I think in developed country, I'm not sure they are doing this, and blind FNA, fine needle aspiration, but there are some limitations. In some centers, you don't have ultrasound device in their radiology center, anyhow, in their endocrine.
You mean it's not a regular kind of ultrasound instrument? It is specified or?
Of course, there are some portable devices that all of the endocrinologists can have it, and it is really useful for not for doing a biopsy, anyhow, for diagnosing the situation and diagnosing the thyroid nodules. It is very good. Anyhow, if it is done, FNA or fine needle aspiration is done with ultrasound, it will be really great.
Very good. Very enjoying conversation. I learned a lot.
If there is,
thank you. If there is another thing missing in our conversation at the end of the conversation you want to add, we are glad to hear.
Nothing. I think I just have a suggestion. All of the endocrinologists do this procedure, FNA with ultrasound guided biopsies, and I suggest all of the endocrinologists to do it.
Very good. Thank you. Thank you for being here in this conversation. Thank you for following us, and I recommend you to follow us for more information about this course and similar other courses provided in this university. Please follow us and contact our expert team, and thank you for watching.